Continuing with the pharmacological actions of aspirin, the next action is on acid-base balance. Okay, so normally whenever you give aspirin, at first there is respiratory stimulation. As I told, at the normal dose it causes respiratory stimulation. At that particular time, what happens is the carbon dioxide is removed from the body. That normally causes respiratory alkalosis. Okay, so this respiratory alkalosis is compensated by increased excretion of bicarbonate ion. Okay, but at the higher dose, it causes carbon dioxide retention and there is respiratory depression. Opposite changes takes place, which causes respiratory acidosis. Okay, on the other hand, aspirin is known to cause dehydration because there will be increased loss of water from the body. Okay, the next action is on cardiovascular system. So normally at the normal dose, it doesn't have any effect on cardiovascular system, but when you give the drug at the larger dose, it increases the cardiac output to meet the peripheral oxygen demand. Okay, and this peripheral oxygen demand is normally by vasodilation, that is dilation of the blood vessels. Okay, but when you give the aspirin at the toxic dose, still higher dose, it is known to cause depression of vasomotor center, which leads to decrease in blood pressure. Okay, the next action is on GIT. So normally aspirin, it is an acidic drug. It normally causes irritation of the GIT. Okay, so what happens is it is known to cause epigastric distress, nausea and vomiting. Because what happens is acidic drug, it normally causes irritation of gastric mucosa. So if you consider this as the stomach, so if the layer, so usually erosion can be seen and you can see sometimes bleeding occurring in the stomach. Okay, the next action is on urate excretion. So uric acid excretion normally depends upon the dose of aspirin what you are administering. So if you give aspirin less than 2 grams per day, then it causes urate excretion. If you give less than 2 grams per day, it causes urate retention. If the dose is between 2 to 5 grams per day, then the action of the drug is variable. And if the dose of the drug is more than 5 grams per day, then it causes urate excretion. Okay, and the last action is on blood. Okay, so in the mechanism of action, I told it inhibits the prostaglandin synthesis as well as the thromboxane A2. So normal process, thromboxane A2 is responsible for the platelet aggregation. Okay, so here what happens is when you give aspirin inhibits the platelet aggregation, so it increases the bleeding time in the individual. So the drug will be more preferred in patients with post-stroke as well as post-myocardial infarction. Okay, so this is regarding the various actions of the drug. Okay, so already pharmacokinetic profile, adverse effect, drug interactions, precautions, contraindication and uses, already the video has been sent. So please go through this actions as well as the mechanism of action of aspirin. Okay, remaining I'll be continuing in the next class. Thank you.